Are you familiar with Lynch syndrome? If not, you should listen to this, especially if you work in primary care or with pediatrics, because I have had a few patients come in with this diagnosis recently, and I needed to learn about it because I had been pretty unfamiliar with it. So I'm going to share what I learned with you. Okay. So Lynch syndrome is a genetic syndrome that increases the likelihood of developing certain cancers. The incidence rate of this is about 1 in 300 people, which is actually really common. And the most common cancers that you tend to develop if you have this syndrome: colorectal between 20 and 80%, endometrial cancer up to 60%, ovarian cancer up to 38%. And that's like your likelihood of getting these cancers in your life. Also affects the urinary tract, pancreatic, stomach, and hepatobiliary. This changes in primary care how we screen for cancer in these people. And because it's genetic, you need to know if your patients have it. Could their kids have it? Like if you're in peds, or if their brothers and sisters have it, what is the likelihood that they could have it? And it is autosomal dominant. Okay, so if a parent has it and you see their kid, there's a 50% chance that they have it. And if you're seeing your patient and their parent or their sibling has it, there's a 50% chance that your patient has this. Now, you may have someone who comes in and they haven't been diagnosed yet, like their family hasn't. And this is where you could come in and be like, oh my gosh, I have actually heard of that, and save the day, okay? If you have a patient who has a big family history of colon cancer before the age of 50, who's having endometrial and ovarian cancer and prostate cancer, and you're just like, wow, that's a lot of cancer that are all on this list, you could do a PREM5, PREMM5, which is an online Lynch syndrome prediction model. And it could tell you, based on what you put in there, yes, this person should probably go get genetic counseling to see if they may have this, okay? There's a lot more information at aliveandkickin.org, a lot of patient resources, a lot more information just that you could go and browse and learn things about. I'll leave the podcast that I listened to on my drive to work this morning right here. This gave me a lot of this info that I could launch into and learn a little bit more. So your homework assignment, if you work in any of those settings, is to go listen to this podcast. It was about 30 minutes long. Take a look at that website and just familiarize yourself with it. So if you start seeing these patterns in your patients, or they come in with a family history of it, you could possibly be the person who goes and sends them for counseling and then advocates for the screening that they need so that they do not develop some of these cancers that are life-limiting. Thanks for coming to class today. If you know anything about Lynch syndrome, you have anything to add, any helpful tidbits or any questions, leave them down below. Have a great day. Bye.